Good morning. I'm Don Walker, and I am the Communications Director for Brevard County Government. And thank you for joining us today on our Facebook Live event. We've been holding these pretty routinely to provide residents of Brevard County updates on the COVID-19 pandemic and what our status is here in Brevard County. And as always on our panel today, we have John Davis, who is the Community Health Nursing Director for the Florida Department of Health Brevard. We also have John Scott, our Emergency Management Director, Matt Wallace, our Public Safety Director, and Jessie Ray, who is the Social Media Specialist for Brevard County Government. And she will be monitoring our event today for any questions that are posed by our viewing audience and from the media. So with that said, I'll go ahead and turn it over for an update from John Davis and the Florida Department of Health Brevard. John?
Okay, thanks, Don. So again, we're trending downward. Our case rates are dropping, and that's great news. Each week reveals a better picture, and I expect that to continue. We still have a ways to go to get to that low level of transmission, which is less than 10 cases per 100,000. But I think as we move into next week, we'll be dropping out of the high transmission into a community of substantial transmission. And if the trends hold or accelerate, I think we'll be into that moderate zone fairly quickly. Just going through some of the general things that I do. Testing, we're not seeing the demand anymore. Those numbers have dropped significantly of folks seeking testing. I do encourage folks, though, to go ahead and take advantage of the testing that's out there in terms of getting your own home test kits, which certainly you can do through the covidtest.gov website, as well as purchasing them in stores. Most insurance companies will reimburse for that. And I think that goes to the bigger message that I think John and Don will discuss more in general, but that being just being prepared with your family moving forward. Right now, there's a lot of availability of hand sanitizers, thermometers, pulse oximeters, basic personal protective gear, all that's in good supply right now. So it may be something to think about. Hopefully we don't experience another wave like this. I can't say for sure, but if we do, it's a good idea to be as prepared as we can for that. And having those supplies around is certainly part of that. Hospitalizations, the new admissions have decreased substantially. ICUs have decreased a little bit less so than the general hospital population, but they are decreasing. Long-term care facilities, we do still see outbreaks, but they have substantially decreased as well. And the good news there is that most folks in those settings are not requiring hospitalizations, likely due to the high volume of vaccination among that population. Schools are looking tremendously better. I believe it's 60 cases over the last 7 days for the whole school system, which is a vast improvement over what we've seen the last few weeks. Vaccination rates, again, pretty much at a standstill for the most part. I think our preteens just came up 1% from last week, but again, total percentage of population vaccinated is still at 70%. Deaths are declining as well. Again, that probably is going to be one of the last indicators to show a substantial decline, but it is heading in that direction, so that's a good thing. In terms of treatment options, particularly with the antivirals that we're hearing more about, you can visit Florida Health COVID19.gov for information on that, and certainly talk to your primary provider as well. And essentially, that's where we're at this week.
All right, thank you, John. So John Davis mentioned testing, and Brevard County Emergency Management has been supporting 3 testing sites throughout the Omicron variant, and I will turn it over to John Scott for an update on that and more. John?
Thanks, Don, and good morning, everyone. Again, my name is John Scott. I'm the Emergency Management Director for Brevard County. Talking about testing, continuing to highlight not only are there the sites that we've got, that we partnered with the Health Department, City of West Melbourne, and Parish to continue to bring to folks, but Walgreens, CVS, Publix, urgent care centers, doctors' offices are all doing tests, and those are widely available throughout the county. And that's something that John touched on, that we're not seeing the demand there anymore. But I also want to highlight, while we're talking about testing, the importance of, we know there are cycles with testing, just as there are cycles with waves of COVID so far. And now is not the time to sort of wait until that next cycle. John talked about the importance of being prepared, especially on the testing kits. So if you have the ability, get them from the federal government. Insurances are required to reimburse for up to 8 tests per month. That does include at-home kits, so you can purchase them and then get with your insurance company on how to get reimbursed for those. So there are a lot of options to make sure we're ready should we see a spike in numbers. Also, I want to continue to talk about just what John talked about, which is, while our numbers are falling, they're not falling as fast as we would like. And that's been a constant theme here is, there are actions that we can all take as community members to make those numbers fall, right? We have an active role in this pandemic response. So doing things like, avoiding crowded spaces, or minimizing your time in crowded spaces, especially if there's poor ventilation while numbers are up. Good hand washing, face coverings, staying home when you're sick. Again, I'm going to emphasize, we talk about that a lot, staying home when you're sick. If you don't feel well and you are, socializing, you're going to work, you're interacting with people, you are increasing the risk of everyone around you. The simplest, best thing you can do is stay home, and you just end that cycle of transmission right there, which is what we're shooting for. So those are big steps. We want to make sure that we're doing everything we can to get down, not just out of high transmission into substantial transmission, but really what John talked about is getting into that low transmission, which would be that kind of steady state approach. And then just emphasize, let's not wait till the next wave comes to get prepared. Like, we have a really strong culture here in Brevard and in Florida of hurricane preparedness. We know that, hurricane season starts in June, so we start preparing, well in advance of that. We don't wait till the storm comes and then scramble to get everything. Right? We have a long history of knowing that if you want bread and water, you don't do it, 2 hours before the storm comes, because the shelf's going to be empty. The same stuff's going to happen with COVID, right? When we talk about testing supplies and things like hand sanitizer, like all of that stuff goes up in demand when more people want it, and it makes it harder for you to find. So buy it today, be prepared, so we're not waiting for that next wave. Don?
Thank you, John. I want to mention that throughout the COVID pandemic, the federal government has provided Brevard County millions of dollars in assistance that we've used to help small businesses and others that have been impacted by the pandemic. And one of those areas is in rental assistance, because we know people were financially impacted. At one point, we had $18 million from the federal government that we were able to use in that program. And we still have, as of today, $7.5 million in rental assistance funds available. And applications for that money are readily available at all county libraries, and also online at our website at www.brevardfl.gov under Housing and Human Services. And on that page, under Housing and Human Services, at the bottom of the page, you will find an application form that you can fill out for rental assistance. The main thing that I want to share with that is that you don't want to wait until you've already received notice that you may be getting evicted. You want to do it when you realize that you are having financial problems and may need help. So get those applications in. There's plenty of money available. And the money that we receive from the federal government is not perpetual. We don't have it until it runs out. We've been given a September 30th deadline to get those funds expended. So please bear that in mind, that there is a deadline of September 30th to get those applications in and for us to get that money out there to you. So again, if you need help to pay your rent or even to pay a utility bill, reach out to us. We've got money to help you out. I'm going to go ahead and turn it over now to Jesse Ray, who's been monitoring our event for any questions that our audience may have posed, and also any questions we may have received from the media. we'll address those, and then once we're done with that, I'll turn it over to Matt Wallace, our Public Service Director. So Jesse, anything for us to respond to?
Yeah, so I will start with our media questions first. It appears that COVID-19 will be around for a long time or forever, much like the flu. What would you say is a target for an acceptable rate of infections per week in Brevard County, and how long do you think it will take to get there?
Well, again, we would hope for low transmission. That's less than 10 cases per 100,000. I'm a little reluctant to predict exactly when we'll see that. We've had times where we thought we were out of the woods before, and then here comes Omicron. So yes, I think it's clear we're heading into the endemic phase, and it likely will be with us for a while, if not forever, in some form or another. But again, we would hope that as this evolves, the strength of the virus will lessen, so that again, it's not, hopefully it'll lose some of that transmissibility, and again, the virulence of it will decrease, hopefully, over time. Again, I'm sure things will continue to evolve along with it. Our response, guidelines will change as the situation on the ground changes. I'm sure the vaccines will change over time. And that's about all I have on that.
Okay. The DOH has said in past briefings that there continue to be outbreaks of COVID-19 at long-term care facilities in Brevard County. Can you go into more detail on that as far as the number of cases and maybe where they have occurred?
I'm not going to get into particular facilities other than to say that, when we say outbreak, epidemiologically speaking, an outbreak at a congregate facility means one or more. So literally, when we say outbreaks, that could be a facility that just has one or two cases. I can say that we are not seeing what we saw in the early parts of this pandemic, where we had a large percentage of clients in these facilities positive. I mean, we're talking ones and twosies. We're certainly not seeing where half the facility is infected or anything like that at this point. Again, a reflection of what's going on in general and in our community, and so they've certainly seen the decreases as well.
Okay. Given that the CDC intends to loosen mask requirements, what are your recommendations on mask wearing?
Well, again, I know the CDC is going to be coming out this afternoon. I'm not sure exactly what that's going to look like. They're going to consider additional factors like hospitalizations in the local communities and death rates and things of that nature, bringing in more statistical analysis to come up with the different levels. It's been based on case rates up till now. So I think there's a little bit of an evolving take on that, based on, particularly with this dominant Omicron variant, and the fact that, most people are having mild symptoms, if any at all. I mean, again, we still have that small percentage that have trouble with it, but, I think they recognize that, and so they're taking that into account. In terms of our recommendations, again, let me stress that our health department is an integrated system. We're not coming out with recommendations on a county by county basis here. I mean, this is driven as one department from the state level. So again, based on the guidance that comes down from that level, that's what we put out.
Okay. Are we entering a new phase of the pandemic response? And if yes, what does that look like? How have your previous recommendations changed under this new phase?
Well, again, in terms of the transmission rates, we're still in the same, we're still in a high transmission rate. So I think that messaging of social distancing, hand hygiene, avoiding crowded places, that remains the same. I hope that we eventually get to a point where we don't need to be recommending that anymore, but I would just caution that regardless of what level we're at transmission, or if we're having no transmission at all at some point, some of these things are just common sense, good measures. Hand hygiene, taking care of your own health, being as healthy as you can. I mean, these are things that we should be doing anyway, regardless.
Okay. And John, are hospitals still overwhelmed?
No, they're not overwhelmed.
Okay. Is there any new information on Pfizer and Moderna producing vaccines for younger age groups, like the 6 months and older age group?
I know that's been put on hold. There was some data showing, I believe it was the 2 to 4 range. They were looking at the viability of that and the levels that it was showing. They wanted to hold off and do additional studies. So I have not heard an update on when that might be coming out.
Okay. So then, do you have any guidance for families with children that are younger than 5 as these recommendations for mask wearing and such kind of relax?
Well, again, it would be paying attention to the trends, seeing where we're at as a community. Certainly when we eventually get to that point of being a community of low transmission, I think certain things can be relaxed. At this point, however, let me emphasize again, we're still at that point of high transmission. So there is still a lot of disease out in the community. So I would be mindful of that. Again, hand hygiene, social distancing, avoiding crowded public indoor spaces as much as you possibly can. That would be my recommendation.
Okay. So, John, we've talked about this a few times before, but can you kind of just go over how we as a county and have kind of helped to educate our residents, our visitors, and how we work to kind of stop the miscommunication about the virus?
Sure. I mean, I'll give it a shot. And I think the challenge that we all face, and regardless of what the topic is these days, is there's so much information. Sometimes it's hard to figure out truth from noise. The way we continue to do it, and Jesse, you and Don are large parts of our success there, is, we communicate through social media, which is Twitter and Facebook. We have text alerts that you can get from us. We have it on our website, put out press releases anytime there are significant changes. And we continue to, all the information we share is rooted in experts. So that's the Department of Health, that's the CDC. Those are our big experts for this, and we continue to share that information. And that's what we'll do regardless of the event.
Okay, thank you. Don, you mentioned the funds that we have, and we continue to say that, you got to get it to us sooner rather than later. Can you kind of go into maybe a little bit of why we can't just cut checks, or why we have the process that we have to getting people those funds if we have so much funds to give out?
Sure. Well, number one, it's not our money. So when the federal government provides that money to us, we're subject to audits, and we have to justify to the federal government how we expend those funds, and basically have to be able to dot every I and cross every T so that we can prove to them that we spent that money as directed. And if there are any dollars that we spent that fall out of those directions, then we could be subject to having to pay that money back, which that would then become Brevard County government's problem to use taxpayer funds that should have been earmarked locally to send back to the federal government. So it's extremely important that not only do we do what the federal government tells us, but in our due diligence to do that, that the information that we require on those application forms, things like proper identification, financial information, leasing information, that we have all those in order before we can sign off on the grant and then provide that to our residents. But, it's not really a difficult process. It may be cumbersome, but, as long as we get the information that we're asking for, we can turn that money around quickly and get it to you. If we are seeing problems or things that are missing, we're not just putting the application to the side. We're reaching out to the folks that have applied, and we're letting people know that, you're missing certain types of information and to get it to us. Those who haven't, once we've made contact with them, I can't explain why that's happening. We have had those incidents, but we are getting money into the hands of people that need it. And really the main message today is that we do have that money still available. Can we just pass it out to anybody that walks into our office and says they need assistance? Well, the federal government won't allow us to do that. But we are working in any way possible to either get that to the residents or at least to your landlord so they can, have you covered and you can continue having a roof over your head.
Right. And I do think it's important to note that for residents who maybe need help with that, they don't have a computer or whatever the case may be, our local libraries are here to help. And I know that Ian Golden and his team have had several people walk into their office and they've helped them there on the spot. So there is help available, and, we don't try to just let the residents figure it out on their own. So.
Right. And I want to say again, our goal from the onset of this is to get that money into the hands of residents that need it. So we're not trying to hold on to that money. We're not making outrageous bureaucratic demands or requiring certain types of forms that are outside the box. We're strictly asking for what the federal government says that we need to have people comply with so that we can get that money into their hands and then justify it to the federal government when the program ends September 30th that we spent the money as directed by them.
Absolutely. So we gave some numbers on reporting and testing and those kind of things. What is our determination on non-reporting positives due to home testing? Do those get included at all, or do we have a estimate that we just include?
No, those aren't included. It's only documented positive test results that you see in the statistics. And so, obviously we know there's plenty of testing going on with the home kits, and that's fine. At the end of the day, we're not going to capture everything. And we've always known that despite what the actual result is of the positive test available from week to week, there's more disease out there than that. There's people that don't test, that may be asymptomatic and don't know they have it, or they're symptomatic and they never got tested. So that's always the case with any disease. But again, I think the bigger picture is just kind of the self-awareness and having the ability to test and then not expose yourself to others and be able to isolate immediately.
Okay. John, have we been working with churches and social service agencies to help citizens that need help with rent and utilities? Like, are we reaching out to those kind of entities to make sure that residents are getting all of the assistance that they could possibly get?
So I know Ian and his team at Housing have a pretty broad network in which they interact with on a regular basis. I know they've made a concerted effort to get those messages into those underserved communities. Certainly, we have relationships with churches and other nonprofits and communities that we also share that information to on a regular basis. I think when we talk about the assistance that's available, specifically when it comes to rental, the options are there, but it takes two folks to do that help, which is, there's the party that has the assistance, but we need that party who needs the assistance to come forward and then work with us and work with Ian and his team to make sure they get all the information they can.
Yeah, we know everyone's not going to come walking through our door, but we have taken the initiative through Housing and Human Services to reach out to housing organizations in our county and even schools to, identify those people that might need our assistance and reach out to them. So we're working on those avenues as well.
Okay, thank you. The CDC is announcing today that they are backing off of the high transmission figures as the sole determinant of masking recommendations. So will Brevard County mirror that guidance when it does come out? I think we kind of started to go over that.
Yeah, and John, I'll jump in for this one. I think we need to see what that guidance is first before we make any conclusions.
Yeah, and also just to reiterate what John Davis said is that regardless of what the CDC does, the FDOH Brevard will follow whatever direction the state FDOH provides.
Okay. And I think the last question that I have for today is, should high-risk people still be wearing masks in public places?
Well, again, I would leave that up to the individual. You take the best measures that make sense for your particular circumstance. Certainly those that are immune compromised, I mean, we've known from the beginning that they're more vulnerable to this. And they need to use any measure that's available to them. Masking is one of them. So is vaccination, so is booster vaccination, social distancing. All those things that we keep hammering home about are measures that individuals can take. Again, those individuals are going to have to make their own determinations at the end of the day and make the best decision for them.
Okay, that's all I got for today.
All right, so before I turn it over to Matt, I just wanted to tell everybody that throughout this pandemic, we've held these Facebook Live events in lieu of holding press conferences, just so we can, get our messages out to the community on what you need to do to protect yourselves, and also just to update you on a week-to-week basis as much as possible on where Brevard County stands in terms of pandemic numbers. When the numbers have been high, we've done these on a weekly basis, and when they declined somewhat, we've gone to an every other week basis. And as we continue to decline and are getting lower and closer to a community of low transmission, this will likely be our last scheduled Facebook Live event on the pandemic. We will continue to post our messaging and any information that we get on a week-to-week basis on social media. And if the event arises or the need comes along, we will schedule these as warranted, but there is nothing on the bubble, at least on the calendar, looking forward unless something comes up in the very near future. So with that note, I am going to pass it along to Matt Wallace, the Brevard County Public Safety Director, for some closing thoughts. Matt?
Thank you, Don. And as I listened to the discussion that was happening up here today, all the things that I was going to say have been said multiple times throughout this panel of professionals that we have up here on the dais that as we give these updates to the community. One of the central tenets of county government is to get resources and information to our citizens so they can make the most informed and best decisions that they can for themselves and their families. And John and Don, and we've all said the same things over and over and over, that we've been in this COVID fight for 2 years, and we have a lot of lessons learned over the last 2 years of things that work, things that don't work. As John Scott said before, remember those lessons as we go through surges, through Delta, through Omicron. Services get scarce and demand goes up. And right now, the demand is going down. So prepare yourselves. There could be another surge. There may not be another surge. But the lessons that we've learned over the last 2 years, keep yourselves and your families prepared. And you do that by being proactive and seeking information out in any source that you can, to include these weekly, bi-weekly information sources we have, the posts that we have on social media, all the information that we push out. Again, one of the central tenets of county government is to get that information out to you so our citizens can make those right decisions. And we keep hammering that over and over. So please, please get the information out, make those decisions for you and your families of what will work for you in your particular circumstances. This COVID is with us in our community. I believe firmly it'll always be with us in our community from here. It's there. We are in that steady state now of it's there, and how do we respond to it? And you respond to it by being informed, making the right decisions, getting the resources the county government provides to you through the monetary programs we have through the federal government, or the information services that we have through testing, through vaccinations, those kind of things. So again, please stay informed. Please hang with us. Please watch the social media. Please continue to inform yourselves as you make those great decisions. As we move to that steady state of COVID being in our communities with us, make those great decisions for you and your family. And we will continue to get through this. We'll get through it together, and we'll get through it as one team in one fight. We have one common enemy, and we'll continue to fight that. So I just want to thank you all for your patience. Thank the panel up here for your professional opinions, the guidance that you give, the directions that you give, and then I hope the folks in our county have listened to these professionals up here as we talk and we give these recommendations, that you go out and again find that great information. So thank you for letting us be a part of your success through this COVID journey. And again, if there's anything we can do for you from a county perspective, please let us know how we can help. Contact us anyway. We'll be sure to be there for you. So, Don, thank you, sir.
All right, thank you, Matt. I don't know how we do it, but we always seem to end this right at noon, so we don't even plan this ahead of time. But anyway, thank you for joining us today, and that concludes our program.